The Unicare plan allows you to go nationwide. This plan allows you to go nationwide. Folks have made the comment that the Unicare plan has 0 copays. This plan has 0 copays. The Unicare plan pays after Medicare. It pays what Medicare doesn't pay. This plan pays what Medicare doesn't pay. The Unicare plan requires that your provider accept Medicare. This plan requires that your provider accept Medicare. So I just want to be clear, folks. If the primary concern is understanding what is the plan that's most like the Unicare plan. What is Unicare? Unicare is the plan that's most subscribed in the GIC. You may be on a different plan. So there's also a Harvard Pilgrim Enhanced. This plan is also very similar to the Harvard Pilgrim Enhanced. Okay. I'm sorry, sir. I'm sorry. And so the Tufts Preferred and the Harvard Pilgrim Enhanced allow nationwide access. So and they have 0 copays, just like this plan does. I would say either the Medix 2 or the Managed Blue for seniors that I'm going to discuss right now. So let me just, your questions aren't going to change much by me going over to the Managed Blue for seniors plan. Let me start talking about that, and I'm going to ask your questions. So we have an offering, the Medix 2, that is a national network of providers. Okay, so we've talked about the Medix 2. The Managed Blue for seniors plan is also a rich plan. It's a little different. But the Managed Blue, the primary, or one of the primary differences between the Managed Blue and the Medix 2 is that it works here in Massachusetts. So you have emergency room coverage around the country. Okay, so you're still covered if you're traveling to go see a grandchild or whomever around the country. But this plan is rooted here in Massachusetts, okay? It's kind of like a local HMO platform. So let me go through that. If we can go to the Managed Blue Benefits Summary. So the first thing that folks are going to see when they open up the summary is that this plan has copays. So the Medix 2 plan had no copays, right? Things were covered at 100%. The plan worked nationwide. This plan, as long as the hospital, or this plan works in Massachusetts, and it has a copay. So routine office visits, a $10 copay. Your visits for allergies, chiropractic care services, cardiac rehab services, they now have a copay, or they would have a copay if you took this plan. It would be a $10 copay for each visit that you had. Inpatient care, if you go to Mass General, if you go to Leahy, if you go to Dana-Farber, hospitalization is covered in full. It doesn't matter if the bill is $5,000. It doesn't matter if the bill is $50,000 or if the bill is $200,000. Hospitalization is covered in full. Okay? So we had a Medix 2 plan, nation